Just when Europe thought it was clear from its nightmare with COVID, a single case of Mpox in Sweden was reported on August 15th, 2024, reigniting fear of a potential outbreak across the continent. As travel links with Africa remain strong, experts warn that this might be just the beginning. With the risk level creeping up from very low to low, what does this mean for Europe? And what might this mean for the world? Welcome to That's Life, I Swear. This podcast is about life's happenings in this world that conjure up such words as intriguing, frightening, life-changing, inspiring, and more. I'm Rick Barron, your host. That said, here's the rest of this story. Global health authorities were caught off guard when Sweden reported a case of the newly renamed Mpox virus, formerly known as monkeypox, on August 15th of this year, marking its first appearance outside of Africa. This development came on the heels of the World Health Organization's declaration of a global health emergency, prompted by the escalating crisis in the Democratic Republic of Congo. The Swedish case involving an individual recently visiting an infected region confirmed experts' predictions that the virus would inevitably spread beyond its original epicenter. In response, the European Center for Disease Prevention and Control issued a stock warning, anticipating a high likelihood of additional imported cases due to the frequent travel between Europe and Africa. Mpox cases have surged by 160% in Africa during the first 7 months of 2024, compared to the same period in 2023. This year, more than 15,000 cases have been recorded, with 537 fatalities, the majority of which have tragically involved children. The virus, which primarily spreads through close physical contact, remains a significant public health concern across the continent. The European Center urged member nations to bolster their preparedness measures to mitigate the risk. Additionally, they recommended the issuance of travel advisories, encouraging individuals planning trips to affected areas to explore vaccination options if eligible. This unexpected emergence of Mpox in Europe has heightened concerns among the health officials worldwide, underscoring the need for increased vigilance and proactive measures to contain its spread. Now, why does this matter? Supplies of vaccines and tests could be quickly squeezed if there's a major outbreak, prompting appeals for donations and for researchers to look for new vaccines. Another potential problem could be the temptation for rich nations to start hoarding Mpox vaccine stockpiles for their own populations, a situation that should be avoided at all costs. The global health community is on high alert following recent statements by Dr. Pamela Wagner, who heads the European Center for Disease Prevention and Control. In an interview, she emphasized that the uncontrolled outbreak in Africa poses a significant threat to Europe and North America. The rapid proliferation and expanding reach of this disease in Africa inevitably increases the chance of cases surfacing in European and American territories, Dr. Wagner cautioned. Her words reflect growing concern among health experts about the potential for cross-continental spread. The ECDC has revised its risk assessment for EU citizens in response to these developments. Now, while the overall risk has been upgraded from very low to low, the agency stresses that individuals traveling to and from affected African regions face a considerable high risk. ECDC strongly advises such travelers to exercise extreme caution and take necessary precautions. This shift in risk evaluation underscores the evolving nature of the outbreak and the need for heightened vigilance on a global scale. Now, we need to have an understanding of the Swedish Mpox case. The recent Mpox case in Sweden has brought attention to a new strain of the virus. Experts classify Mpox into distinct genetic groups, or clades. Clade 1, prevalent in the Congo, represents a newer variant, while Clade 2 includes the form responsible for the 2022 global outbreak. Here's some additional data to reference. Mpox is a zoonotic disease, meaning it could be spread from people to animals. Both strains spread via close contact when an affected person or animal are contact with contaminated materials. Now, both strains have similar symptoms, including flu-like symptoms, and a rash can initially resemble pimples or blisters. Sweden's case marked a significant milestone, the first clade 1 diagnosis beyond African borders. Magnus Gillison, a state epidemiologist with Sweden's Public Health Agency, reported that the patient received prompt medical attention in Stockholm. Despite no additional cases being identified, the incident has sparked public concern. The situation evokes memories of the COVID-19 pandemic. In response to this development, several European nations have taken action. Sweden, Italy, and the United Kingdom have all issued public health alerts and outlined strategies to address potential outbreaks. Now, this case underscores the ongoing global health challenges and the importance of international vigilance in disease monitoring and control. Comparing the current Mpox situation to the 22 outbreak, let's talk about that. The Mpox landscape has evolved significantly since 2022, presenting what Dr. Paul Hunter, an epidemiologist at Norwich University in England, describes as two distinct epidemics. The 2022 outbreak primarily involved clade 2B, B as in boy, which spread mainly through sexual contact, particularly affecting men who have sex with men. Behavioral changes and vaccination efforts helped curb its spread, though new cases continue to emerge. The World Health Organization reported 100 new infections in Europe and 175 in the Americas in June of 2024. Clade 1 manifests in two subtypes with different transmission patterns in vulnerable populations. Clade 1A spreads through household contact, animal exposure, and sexual contact. Young children appear more susceptible. Clade 1B primarily transmitted through heterosexual intercourse. The recent case in Stockholm confirmed this subtype. Mpox symptoms mimic common respiratory illnesses before progressing to a distinctive rash on the mouth, extremities, or genitals. Transmission occurs through close physical contact, infected bodily fluids, or contaminated items. Health experts believe that the Jynneos vaccine, effective against the 2022 variant, should protect against all Mpox strains. Generally, individuals with robust immune systems are less likely to experience severe Mpox symptoms. This evolving situation underscores the importance of continued vigilance and adaptability in global health responses. Currently, Sweden stands alone outside Africa in confirming a case of the new Mpox variant. This isolated incident has alerted global health authorities, prompting increased surveillance worldwide. Now, in a parallel development, Pakistan reported a new Mpox case recently this year. The patient, a 34-year-old individual with recent travel history to a Persian Gulf state, represents the country's first reported case this year. However, health officials are still working to determine the specific Mpox variant involved. Dr. Giovanni Rezzia, formerly Italy's Director General for Prevention and now a public health professional at San Raffaele University in Milan, offers a nuanced perspective. While he views the latest Mpox outbreak as primarily a regional emergency centered in Africa, he emphasizes the need for global preparedness. The doctor went on to say that Europe must remain vigilant, underscoring the importance of proactive measures and heightened awareness across the continent. His statement reflects a growing consensus among health experts that while the new variant's spread remains limited, the potential for wider transmission calls for ongoing attention and readiness from health systems worldwide. This evolving situation highlights the interconnected nature of global health and the critical importance of international cooperation in disease surveillance and control. Now, European nations are adopting a two-pronged approach to tackle the Mpox challenge, focusing on domestic and international efforts. On the home front, countries are intensifying their response through several key measures: enhancing awareness among healthcare providers, 2, ensuring swift treatment for infected individuals, and 3, implementing rigorous testing protocols for those in close contact with confirmed cases. However, recognizing the global nature of the threat, European countries are also extending their efforts beyond their borders, particularly to Africa, the epicenter of the current outbreak. In a very significant move, the European Union has pledged to provide over 175,000 Mpox vaccine doses to African nations. This initiative is part of a broader international effort to bolster Africa's defense against the disease. Bavarian Nordic, a key vaccine manufacturer, has committed to donating 40,000 doses, which will be distributed under the backing of Africa Center for Disease Control and Prevention. The United States has also joined this collaborative effort, promising 50,000 vaccine doses. Additionally, France has announced its intention to contribute vaccine supplies to affected African countries. These coordinated international actions underscore the global health community's recognition that combating Mpox requires a united, cross-border approach. By supporting Africa's fight against the disease, European nations aim to assist those directly affected and reduce the risk of further global spread. Now, as this podcast was being produced, news broke out on August 21st, 2024, that Thailand reported a case of Mpox in a traveler who recently arrived from Africa. Authorities are conducting tests to determine if the patient is infected with a new strain of the virus. If confirmed, this will mark Thailand's first case of clade 1b Mpox. So what can we learn from this story? What's the takeaway? We must not underestimate the pandemic potential of Mpox. If cases were to take hold in Europe, it could lead to rapid and sustained transmission across the region. Immediate and coordinated action is essential here, particularly in ensuring equitable vaccine distribution. The lessons from COVID-19 and numerous previous health crises have shown that complacency and delays endanger everyone. Well, there you go, my friends. That's life, I swear. For further information regarding the material covered in this episode, I invite you to visit my website, which you can find on Apple Podcasts, for show notes and the episode transcript. As always, I thank you for the privilege of you listening and your interest. Be sure to subscribe here or wherever you get your podcasts so you don't miss an episode. See you soon.